your beliefs, your philosophy, your skill set, rather than doing it based on a guru and what they teach you. And years ago, I went to a seminar where the doctor was teaching the ways that he was successful, but really didn't fit me. And after the seminar, he was somebody entirely different, and I kind of found that to be two-faced, totally uh, different than the persona that was projected at the seminar. So today, I want to talk about how you can build a practice uh, around your systems, your beliefs, your philosophy of how to run a practice, and then how to encourage others to join your practice and to teach them. So we're going to talk about that today. So this is for the practitioner who's doing fine and dreading Monday. This is a webinar for you, and it's for you to make practice more enjoyable, for you to enjoy working with patients and your staff and your systems in the office. If this isn't you, this webinar may not be useful. So if you don't have that feeling of apprehension going into the office, if you're not struggling with um, different parts of your practice, then this webinar may not be for you. I'm drawing from 31 years of experience, and a lot of those years were at my own. Some of them were in a group practice, and then I've done a lot of locums too, where I've for other doctors and seen their practices, over 80 of those locums. And so I've had a very career and understand different practices, and developing my own and having a multi practitioner clinic. So if you feel like the schedule's full and it still feels a bit fragile, it's not strong, it doesn't have a good foundation, if you've absorbed tactics that you don't quite believe in or you may not be comfortable doing in your practice, reason the place works, you can't take a vacation, you can't have somebody take over for you because it's too much based on you. You would grow, but it's not. But if it isn't for you, this costs you very little. So if you want to grow your practice, but yet you're just not sure where to start, this practice is for you. The practice that runs you, it looks like success from the outside, but inside, the performance is always based on you. So it's very much an ego-driven practice. It's a warm public face bolted onto a colder private reality. Pressure closes the first sale and then quietly kills referrals. So it's a pressure-driven practice. It's very hard to work in when it's set up that way. One point of failure could be you, and then that could result in a really bad year. So it's just so much dependent on that one practitioner and the way they do things. So the drift is you don't choose the ego-driven practice, you drift into it. And one day you look up and you think, well, how did I get here? And it's running you rather than you leading the practice. Now, if you're interested in the booklet that goes with this webinar, it is published on Amazon. You just have to scan this QR code in the corner. I'll have that up on the subsequent slides. There'll be a booklet with the same name as this webinar, so you can get that accompanying booklet. There'll be some previous books that I've published on Amazon as well, and those are all related to practice and practice success. And there's also some other services there, which we'll talk about later. So why the usual advice fails? It's because you're selling and not teaching. So we really want to talk about teaching and not selling, the opposite. So nobody gets stronger because someone sold them a package. What you want to do is you want to lead with good quality information. You want to lead with clear expectations. So this webinar teaches you how to do that. It's not about scripts and urgency and objection handling. The care plan as a revenue target and wins for that first transaction. What it's actually about in this blue box is honest teaching, the care plan as a prediction, and a guide, and it helps you to win and grow that practice so that down the road it's very strong with lots of referrals. Just like in the clinic, we talk about removing interference and letting the body heal itself. We use a similar type of principle um, for health professionals. So basically, practice should be able to run on its own. It should be very simple. And sometimes I find with doctors and therapists, they're just getting in their own way. They're just doing things that are interfering with that practice running on its own and being successful. And we say that for the body too, that we want to remove the interference and let the body heal. So we don't have to do a lot to it so that we're kind of micromanaging the body. So it rules out dependency, plans, and fear-based pitches. And the pricing, plan length, and marketing all fall out of this one idea, which is building the practice from the inside out. You want to lead without ego. So the guru wants to be needed, but the leader wants to be unnecessary. Two different approaches where the pull is towards the center, and that's structural. And every good practitioner knows what that feels like. Build a philosophy the practice shares, not a personality that it serves, and measure yourself by how well it runs when you're not there. So when you're not in the room, maybe there's some other doctors or therapists working with you, or you have somebody come in like a locum doctor and take over for you, and the practice continues to operate smoothly. You are the product. So guard yourself the way an elite athlete guards the instrument. So in the booklet, I talk about elite athletes and how much effort goes into taking care of themselves. And I think for health professionals, you have to do the same thing because you're like an elite athlete in that you're providing a service. You have to make sure you're physically in good shape, mentally in good shape, that you can make good decisions for your practice. So there's a lot that goes into it, kind of like an athlete, an elite athlete would prepare. I just watched the World Cup and some of the elite athletes, the preparation that goes into their diet and their workouts and their conditioning, their sleep, all of these things, very important. And I recommend as a health professional, you do the same things. So sleep, movement, and real rest. You want to tend to that inner well-being, and that's maintenance for you because you are the product. So know yourself, and then also know your ideal patient. So what is your avatar? What are you looking for as far as your ideal patient? Because by knowing that, you're going to know how to market your practice, who your ideal clients are. You're going to define some of your marketing programs. Let's say it's on Google. You're going to know your demographic and what type of patient would be ideal for your practice. So that's important too. And that's something that I talk about in the booklet. So I use an example in the booklet of that's it. So of a patient that arrived and just was wanting to get started, and he wanted to buy a package in the clinic. And I said, you know what? We did the assessment. I gave him my recommendation. I said, we're going to start the care. Here's what you could expect. We're going to do some visits, and then I'm going to give you some homework, and then we're going to reevaluate. And I kind of watched as that trust was built between the patient and myself. And then as he continued to heal and took more responsibility for his health, it ended up being a really good outcome. He trusted me in the clinic, and then he referred others to our clinic. And those are the types of patients you want, not the ones where maybe you're using a script, but one that is more like, you're intentional about what you're doing, and you're also leading by example with the patient. That one honest conversation out-referred every ad that I ever ran. So often the work you're doing inside the clinic and the meeting and exceeding the expectations of your clients or your patients is more valuable than advertising. And advertising can cost you a lot of money if you're doing that on Google ads or Facebook ads or using a marketing company to do that. 5 moves that you can focus on this week. Make these small and concrete, and they're all free. So, one is write down in one sentence your philosophy and how healing happens in your clinic. Number 2, read it as a stranger, audit your website, cut one piece of fear or upsell. Number 3, hold one boundary, name the one you keep breaking and hold it for 7 days. So, really work on keeping the consistency there. Name your patient. So describe the ideal patient. I call them the avatar in 2 specific sentences. And number 5, say the honest thing. Tell one patient the truthful, you need less than you think, and then provide the care and meet and exceed the expectations. So where do you go from here? There's a 90-day roadmap in the booklet, so you can definitely get that booklet and get into the 90-day roadmap to take you from where we are today to 3 months into the future. If you want to join our mastermind group, it starts at the beginning of next month. Small group of professionals. We have 10 seats for that. And then by joining us, we're going to dig deeper into these concepts so you understand what you need to do. I'll be able to answer your questions, and there'll be other health professionals there asking what they should be working on in their practice. And then if you don't like the group format, or if you need some more individual attention, then there's the one-on-one coaching sessions. The first one is just a get to know. And then from there, usually we work in a 13-week sessions. So one session a week for 13 weeks. Sometimes we do that one session every 2 weeks for 26 weeks. But in this package of 13 sessions, it allows us to follow up, to provide some accountability, to build on what you've learned in the past, and continue to develop the systems that you need for your practice. So we can really work on building from the foundation and moving forward with some accountability in those sessions. If you're interested in that, just scan this QR code in the top right corner. That'll take you to our website. And you can also go to Linktree. I put the link right down here, where there's kind of a roadmap of our services and products, including a link to Amazon of the publications in the past, the booklets and the books that we've written on developing a successful practice. If you have any questions, you can type them in the chat. I'll be checking the messages here in the chat, or you can comment below. Like this video on YouTube and subscribe to this channel if you want to see more content like this.